Sandeep Kadam, consultant international cardiologist and founder of Dr. Kadam Heart Clinic and Diagnostic Center, Baner, Pune. I am working as an international cardiologist for last 10 years. So friends, today we'll discuss about the early warning signs and symptoms of heart disease. So it's always better to prevention than a cure. So how to detect early signs of heart disease? First, we'll see what are the signs or what are the symptoms. First and foremost important is chest pain. So chest pain is a major complaint in heart diseases. So chest pain can occur due to different reasons other than a heart conditions like lung conditions, even simple acidity, bony pain, or any lung infections like pneumonia or gastroesophageal reflux diseases. So, how to differentiate from the heart pain? The chest pain, which is related to the heart. So, the first and foremost important is it is a never experience in the life. It is the first time. It's kind of intensity of moderate to severe. It is a constricting or somebody is pressing your chest or heaviness over the chest, and it is associated with the sweating episodes or sometimes kind of nausea or vomiting. That pain can be in the center of the chest or in the right or left arm or shoulder. It can be above upper abdomen or from the uh, area above stomach to the angle of the mandible or below neck. So anything on the front side or back side, right or left is can be a presentation of the chest pain. The chest pain is always associated with prior symptoms like shortness of breath after exertion. So the person who was walking for 5 kilometers and without any complaint and now started complaining of shortness, he needs to wait for 5 to 10 minutes because he get out of breath after walking on plain ground or on a slope or after climbing stairs. So all these are symptoms associated with the chest pain. In the initial stage, the shortness of breath is after exertion, which slowly progress to the shortness even at rest or even in the sitting position. Then patient complaining of breathlessness or shortness, even lying down, and patient could not sleep in the night. He suddenly woke up with the chest pain and breathlessness and sweating. So, what is the next symptoms? Many times, chest pain is not the always present in a patients. There are some patients, like a patient who is having diabetes or immunocompromised patients. They do not have normal presentations. Their presentation is always different. So they do not have a classical heart pain or any kind of pain. They started with the sudden onset shortness of breath or out of breath, and they land up into sudden cough, which is the frothy, pink frothy cough, and very shortness and sweating, uneasiness. So this can be one of the presentations, but it is more common with the diabetic patients. So most of the times, people do not get chest pain and they are misdiagnosed as other lung conditions or some other disease. So you need to be particular about the presentations. So other presentations or other sign and symptoms for the heart disease are leg swelling. So there are both the legs are swelling simultaneously, and which are associated with the shortness of breath and chest pain. These are the symptoms of heart failure, shortness, and leg swellings. It is because of unable inability of the heart to get contract or proper relaxations that leads to the increased back pressure to the lung veins, and that leads to the fluid collection in the lungs, which leads to the breathlessness or shortness of breath. So for these symptoms, there are other symptoms like easy fatigability, palpitations. Palpitation means you feel your own heartbeats, which can be because of lower heartbeats or because of increased heart rate or irregular heart rates. So normally, in a normal individual, the heart rates lies between 60 to 100. When there is a associated heart diseases, the heartbeats may rise up to the 120, 130 or more than that, or may drop down to the 40, 50 like that. Easy fatigability means the person who is active and who was doing all his routine activity without any complaint, and now he suddenly feel that there is a fatigueness and he could not work out, or he or she could not do his routine work. So that again symptoms of heart disease. So uh, so the most important early sign is the chest pain, then shortness of breath, leg swelling, palpitations, and fatigue. So all these symptoms are important. So there are some misunderstanding, or people could not understand, or there is a lack of awareness about the chest pain. Sometimes people get pain here uh, or pain here, so they feel that this pain is because of some dental issue or like that. So they visit their dentist and they found that all things are normal. But friends, it is a classical pain of the heart, which can be present like here only the pain in the mandible region or upper neck. So sometimes the pain may be in the upper stomach, which can be misdiagnosed or which can be taken as a acidity pain. So acidity pain and heart attack pain is totally different, or heart disease related pain is totally different. Acidity pain is always associated with the food, whether it is before the food or after the food, and with antacid it subside. Whether this kind of pain because of heart which is persistent and associated with the increased pulse rate, other symptoms like shortness, other uh, symptoms like leg swelling, palpitations. So we need to consider these symptoms as a heart disease. So how to proceed further? If you get such kind of pain, say chest pain, what to do next? In this scenario, you should go to nearby clinic or nearby hospital. Take your ECG first. Is and if then there are some few other tests for the heart, like two-dimensional echocardiography. That in short we called it as a 2D echo, and some blood tests like cardiac enzyme tests, which are drop T, drop I, or CPKMB tests. These are the common tests done for to diagnose the heart disease. Then furthermore, other advanced tests like angiography, which is needed if these tests showing any positive results or there is a classical pain. So you should always evaluate for your chest pain or other symptoms. Do not neglect these symptoms. Diagnose early and be safe. Thank you.